You're listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our Razorcast studios in New York City, where we are dedicated to bringing you cutting-edge interviews from many of the leading industry professionals across the U.S. In today's episode, we are speaking with Dr. Matthew Phinney. Dr. Phinney is the founder of the Chiropractic Doctors in Grand Rapids, Michigan, where he is committed to improving the health and vitality of his community through chiropractic and wellness care. He is originally from Toronto, Canada, and he graduated from Bishop's University and then from Palmer College of Chiropractic in Davenport, Iowa. Dr. Matthew Phinney is widely considered to be one of the top chiropractors specializing in holistic and alternative health in the country, and he is also a contributing member of our national network of industry professionals. Today we are going to talk about a very important topic, leg pain. Hi, Dr. Phinney. How are you today?
Hey, Liz. I'm doing great. Thanks for asking.
Well, great. Thanks for being here. And my first question is, we think of chiropractors as back doctors. How does a chiropractor help with leg pain?
Yeah, great question. I appreciate you asking that. One of the things we'll see, a lot of times people will come in to our office and we'll ask them sort of what's going on. And leg pain is one of those things that people are commonly experiencing. Sort of deep, dull, achy pain. It can be in the thighs. It can be down in the calves, even into the feet. One of the things we got to look at as far as leg pain is we want to figure out what's causing that problem, causing that leg pain. And so we're not dealing specifically all the time just with the leg. The reason why is neurologically, the nerves that are coming off the spine in the lower back and the hip area are the nerves that go all the way down to the very bottom of the legs, to the very tip of the toes. And they control, really neurologically, nerves control all of the muscle function, the organ function, the glandular function along that entire pathway. The best example I could give you would be somebody, heaven forbid, they're going into the hospital and they're having a heart attack. They have pain in their left jaw, they have pain in their left shoulder, they have pain down their left arm. And if they go into the hospital and they're having a heart attack and all the doctor does is look at their jaw, their shoulder, their arm, well, then they're going to miss something pretty important, right? They're going to miss the cause of the problem. So that problem being the heart. Same thing is true. A lot of times people will come in, they'll say, well, I get pain in my hip, I get this pain in my legs, my knees bother me, it's all on that left side, and then also my toes are numb. But I don't have anything wrong with my back. And so they have a bunch of things all on that sort of pathway that aren't working, that aren't functioning properly. And it's typically either a neurological issue, so there's pressure on the nerves that are supplying those structures, or it can be a structural issue. So something in the hips can be twisted or shifted out of position, which is causing them to put more pressure force on those hips, those knees, those ankles with every step they take, every move they make. And so the way we would help with something like that is we would balance out that pelvis, balance out the hips, take the pressure off the nerves, and get the body working the way that it's supposed to work. One of the things we'll see a lot of times, too, if people have had, say, chronic leg pain, and they'll typically have it in, say, one side, like it's always on the left side, when we start to balance stuff out, they'll notice that the pain will go from the left, and it'll actually go over to the right. Wow. And they'll be like, what the heck's that? What's happening here? I'm getting worse. It's actually not the case. What's going on is if you picture somebody, they've been on vacation for the last 10 years. You have two people that are working. One guy's been on vacation for the last 10 years. The other guy's been doing all the work. Well, all of a sudden, one day, the guy that's been on vacation, you say, hey, time to get back to work. He's typically, for those first little while, he's not happy, right?
Right,
He's used to sleeping in till noon every day, having a sandwich, watching some soap operas, and then going to bed by 8 or 9. Well, all of a sudden, now he's up, he's working, he's doing stuff every single day. He typically doesn't like that. He's not used to doing that. So it's not that he's getting better or worse. It's just that you're changing something that your body was once used to. And so that's how we correct leg pain. That's how we typically get to it, is we get to the cause of the problem. Because there's a big difference between me just, treating your symptom or making the leg pain go away temporarily and then having it come back, and us actually correcting the underlying cause of that dysfunction. Those are all things that we would do in our office.
Okay, that makes perfect sense. And what are the various types of problems chiropractors see with leg pain? I guess to sort of rephrase the question, if somebody comes in with leg pain, what problems are they experiencing? Is it like a limp? Is it, just a little pain here and there? What do you see coming into the office?
Yeah, great question. Really it ranges. Often depends too on how long it's been going on. Longer it's been going on, typically the more symptoms, the more problems that people will have. One of the things we'll oftentimes see is like poor circulation in the legs. So that'll cause like their feet to always be cold. Poor circulation in the legs, numbness, tingling into the legs, like a sciatica type situation. Could be down the back, could be down the front, could be down the side. We'll see a deep, dull ache, could be in the legs. We'll see a lot of knee issues, ankle issues, swollen ankles, swelling in the ankles. Again, blood flow, circulation. Again, that's all controlled by the nerves and the nervous system. Weakness in the legs, like weakness in the arches of the feet. That'll often cause things like plantar fasciitis. So when there's pressure on those motor portion, the motor component of the nerve, over time that muscle will become weaker. It will atrophy. And so the arches of the feet, they're held up, they're kept in position by the intrinsic muscles of that foot. And when there's nerve pressure on the nerves that are going to those muscles, well, what happens is they get weaker and that arch will start to drop or collapse. So fallen arches lead to a plantar fasciitis type situation. And so that's something that can be corrected, again, by getting to the cause of the problem. Cramping in the legs, creepy crawly type, almost like a restless leg syndrome. We'll see a lot of that. And then a lot of other associated things that go with the legs are things that would affect the lower abdominal organs. So bowel, digestion. So we'll see a lot of like irritable bowel type situation associated with that. Constipation, diarrhea, alternating patterns back and forth, bladder, frequent or infrequent urination, recurrent bladder type infections or recurrent urinary tract infections. The reason why, there's bacteria, there's viruses, there's germs, they're, all in our environment. Every single second of every day, we're all coming in contact with the same stuff. And these are what we call opportunistic type infections. If you were a bacteria, you were a germ, you were a virus, and you were to go into somebody's body, where are you going to go? You're going to go to the organs that are functioning at 100%, or are you going to be going to those ones that are shut down because the nervous system is not getting all the supply that it needs? What would you go to?
Probably the one that's shut down because it's easier to attack.
Correct. And so that's what happens.
Yay.
And so people will have, you got it, people will have like, a bladder infection, they'll take a round of antibiotics, and then that kills 98% of everything. But that 2% that survive, that slowly starts to recolonize, and then 2, 3, 4 months later, they're back to a point where it's grown to a point where they have symptoms again. They have another bladder infection. They have the same sorts of infections over and over again. We'll see it if there's pressure on the nerves that are going to the neck, supplying the stuff in the head. So we'll see a lot of people with recurrent sinus infections. Some people's kidney infections. It just depends on where the body's not functioning the best that it should be or could be. So frequent, infrequent urination, that's another one we'll see typically. And then also can relate to reproductive organ stuff. Painful menstruation, irregular menstruation, cramping, bloating. Those types of things are commonly associated with neurological pressure in the low back, which can cause problems in the legs, but also problems in these other areas. Men, we can see erectile dysfunction. Again, stuff that people are pleasantly surprised with that going away as a result of getting their leg pain gone and getting their body working properly. And it's always, it's always refreshing when we see the smiles on people's faces when they're like, I didn't know you guys could help with that. And we're like,
right.
Yeah.
Yeah, we could have another whole interview on all the, just listing all the things people didn't realize that chiropractors can help with. I mean, just the list alone would be worthy of a 10-minute interview. But
sure.
You did touch on this one. The question I had next was, what does numbing or pins and needles signify when you're experiencing that? What does that signify? And I think, like you said earlier, are you having a heart attack? Are you going numb down your whole left side? I mean, people get nervous when they experience numbing and tingling and pins and needles. So can you just quickly talk about what's happening in the body when you start to feel that?
Yeah. Great question. Now, anytime there's numbness and tingling, that is more often than not, 9 times out of 10, that indicates nerve pressure on the neurological or the nervous system component of the body. So that is what we would refer to. Anytime we see numbness, tingling. Now, there are situations where people could have, like, say, pins and needles. If you're, say, sitting on your foot or you're sitting on your hand or you're sitting on, and you're not allowing the blood to flow to that area, when that blood starts to recirculate, that can give you that sort of pins and needles type sensation. But it's typically, like, very temporary, maybe 30 seconds to a minute. If it doesn't go away, if it's still there, if it's coming and going pretty regularly and you can't think of anything that you're doing to cause it, then it usually will indicate there's a nerve pressure. And that can be caused by something in the body shifting, twisting, torquing out of position, causing irritation, inflammation in that area, putting pressure on those nerves. And pressure on those nerves will interfere with how your body functions, and it'll decrease the way that your body works and functions. And the less that your body functions, the more likely it is that you have pain, the more likely it is that you have discomfort, and the more likely it is that over time you'll get sick.
Okay, well, that's super helpful. And also, for somebody, going back to leg pain, for somebody experiencing leg pain, does rest help with alleviating leg pain? The phrase, I'm going to rest my legs, I'm going to put my feet up, that kind of thing. Does rest help with alleviating any leg pain, or is that just, just what people say?
Good question. Again, it depends on what the cause of the leg pain is. Certain situations, rest may be the way to go. Oftentimes we recommend, if it's a leg pain caused by a lower back or lumbar or hip or pelvic issue, we recommend being up and just doing sort of light activity, as opposed to, say, going and resting, and depending on what your idea of rest is. But laying on the couch, again, twisted for 5-6 hours, or just laying in bed, that typically slows down the healing process and can, over time, again, make things worse. So it would really, I guess, depend on what was causing the problem. And the only way to really tell that would be to actually, come in or go see somebody that's trained in the body structure, biomechanics, checking for subluxation, doing motion study films so they can actually see if there is any problem going on. Then I could give you a better answer on that, but it would just really kind of depend on the situation.
Mm-hmm. Okay, that makes sense. And lastly, this question is regarding supplements. People know to take calcium supplements and vitamin D for strong bones. And with regard to the legs and leg pain, are there any supplements that help?
Yeah. Really, any sort of supplement that's going to decrease inflammation, decrease systemic inflammation in the body, will benefit if there's a leg pain issue going on. One of the ones we always recommend like a high-dose omega-3 fatty acid, so like a fish oil. There's a couple different companies that we recommend, but you really get what you pay for in that arena. So that would be one that's great. It works on the same pathways that, say, Advil or Tylenol works on, cyclooxygenase inhibitor, without any of the nasty side effects. So that's one of the things that's fantastic. Your body needs it in order to work, in order to be healthy, but it does a great job of decreasing inflammation, getting people out of pain. The other thing is, we'll see a lot of times, too, people with vitamin D deficiencies. Study came out of the journal Pain Physician 2013, and it was talking about people with vitamin D deficiencies and the increased likelihood that they're going to have back pain and leg pain and nerve pressure issues. So getting on like a high-dose D3, and that's simple as a blood test to figure out where you're at. But if you're not getting 10 minutes front and back bathing suit attire every single day, then it's likely that you're deficient. We're in Michigan here. We rarely see the sun. I don't know what it's like down there in New York City. You guys do okay, but not great.
Right.
So if you're not getting it, then you require it, and that's something I'd recommend.
Okay.
A loading dose and then a maintenance dose. Another one is turmeric. It's great for decreasing inflammation, decreasing inflammation in the body. Getting on like a green superfood. We recommend Wuji chlorella. It's an organic green. Again, it helps decrease that inflammation, helps get rid of pain. So those are fantastic supplements that I would recommend. And we see great results for people that have had, leg pain and leg issues.
Oh, good. Excellent. Okay, well, those are the questions I had today, and this was a really interesting topic, so thanks for sharing all your expert advice and knowledge with us today.
Awesome. I appreciate you having us.
All right, and for our listeners across the country, if you are interested in speaking with Dr. Matthew Phinney, you can either go online to www.thechirodocs.com or call 616-432-3103 to schedule an appointment. And on behalf of our entire team at Razorcast, we want to thank you for listening, and we look forward to bringing you more top quality content from our country's leading industry professionals.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.